Everybody, it's Dr. Eric Balcavage and my partner in crime, Dr. Erica Riggleman. We're back for another edition of Thyroid Answers podcast, and we have a fantastic guest today that we're super excited to bring on because she's going to be talking about one of the kind of the hot topics in functional medicine when it comes to thyroid physiology, and that's something called Epstein-Barr virus. So, Dr. Erica, how are you today? You doing great down there in Winchester, Virginia?
I am. I'm doing great.
Fantastic. So if you want, I'll let you introduce Dr. Kasia Kines because you were the one who read her book and did all the stuff. So why don't you do a short introduction and then she can tell us her story.
Yeah. So, I mean, with her, she wrote this book on the Epstein-Barr solution. So it's a great book. If anybody is interested in learning more about what Epstein-Barr is, that is a very detailed book. It's got lots of information, but Kasia, why don't you tell us a little bit about your background, what got you into the Epstein-Barr and what kind of your whole background and interests are?
Short story is that when you practice functional nutrition, in my case, you attract clients that are very complicated, and the longer you do it, the better you get at it, the more complex cases you attract. So, and I know a lot of clinicians might agree, and maybe you've been in the situation when you feel demoralized because your success rate is not increasing. You have to crack more complicated cases, and in that scenario, over the years, those cases were the chronic Epstein-Barr virus cases, which I didn't know because at the time when I was trying to figure these resistant cases out, there wasn't really any training. I mean, I did all the right training, the best training I could get my hands on in the States. And it wasn't until I did my PhD in nutrition, functional nutrition, when I stumbled upon Dr. Vasquez. He was teaching us virology. And so massive material on just the viral physiology. It wasn't specifically geared towards Epstein-Barr virus, but this really opened my eyes on this whole area that really nobody trains in. It was very methodical, it was wonderful, and it became the backbone of my protocols. But at the same time, some of my clients would be asking, can you read this book? Have you read that book? And this book came popping in again and again. It was called Medical Medium. And so I grabbed the book on the plane because I didn't have time to read. And well, the problem with the book was it was so relevant to my clinical practice that I was thinking if 50% of it is right, I have to do something about it. Literally, I was highlighting everything and connecting the dots of my previous cases, those that I couldn't crack. And so it was like light bulb up to, it was really relevant. Of course, it's a messenger, and in terms of, your faith and your belief system, you may agree with it or not. I don't know, but I had to have an open mind because I wanted to help people. And so enough people asked me to read the book that I did, because then you have to be able to provide your informed opinion to your tribe, right? But as a result of this book, I decided, well, if this is really epidemic and this is missing, let's start asking my clients to test. And then I start to dig in appropriate testing, interpretation, and appropriate testing. And I found it was a mess. So I started to carve out that and learn and do more research on that and systematize it. And I started to see patterns. And the more we tested, the more we found it. And now sometimes I'm even surprised when I ask, well, we might test it or not, and it still comes up in cases that I wouldn't suspect. And so it's just, this is the direction it took. And so then I started to apply the protocol. Then I started to do more research, focusing my PhD program on that. And so I decided, well, the best service I can provide is this. There is, and I plugged into EBV community in social media. So I started to monitor it and learn and listen and contribute. And what I found was that there was this profound ocean, and there were two extremes. On this side, you had great fans of medical medium, people that were applying his dietary ideas and the concept of a lot of the chronic illnesses are driven by chronic Epstein-Barr, this is the epidemic, this is the whole concept, right? Very new. And then on this extreme of the spectrum was medical community. No, it's in your head. Everybody has antibodies. They're irrelevant. If they're resistant to testing, so people spend 2-3 years finding a doctor who will be willing to test. It was just ridiculous. People were sent to psychiatrists, put on antidepressants. Spouses even didn't believe people because it's, you don't present with something physical most of the time. And it's in your head, get a grip, it's just a depression. So this whole big spectrum, and in the middle of it is the ocean. And I thought, if it's true that it's epidemic, and I started to see patterns in my practice, and it was, yes, it seems like it is really, really epidemic, because I had been working with a lot of women, which means a lot of thyroid, which means a lot of Hashimoto's, which means extremely relevant, right? Mm-hmm. And so I said, my responsibility is bring medical research and what we do, literature review, see what we know, and see how much of the medical medium claims I can actually verify in medical literature. Okay. And normally I wouldn't have time for it, but because I was in the PhD program, it's like I have to do it anyway. That's all I'm going to do. And then so I have the literature review, and my colleagues are asking, when are you going to publish? Publish what? Well, right, this is a book material. It's like 75 pages or so. It's like, I don't have a life. I'm so busy with clinical practice. I've never written a book. What are you talking about? And here we go, almost 600 pages later. So basically, my job was, that's how I saw it. I need to structure all that medical information. I need to structure it. I need to put a piece of material that any doctor or any open-minded, forward-looking doctor or practitioner can look at to validate the pain of millions of people that are not being heard. That's the number one. So they can take it to their family members, but they can take it to their doctors. They can look at it and say, it is beyond doubt that this is a problem and we haven't known about it. The research is there, it's in our face. And then the second part of the book is, I really need people to have tools, because I've been working them. And I've been working in clinical practice for 15 years. And basically my philosophy, what I was doing was like training me for this, because it's in sync with what you have to do for EBV. It's very interesting. I don't think there's any coincidences. I
think it's great. The book it's very much written for a practitioner, but it also can be very much understood by the lay person, because you say it in a scientific manner, you have the research to back it up, but then you also put it into a very elementary kind of explanation for a patient to understand, but you also show them what they can then do, give them some knowledge. And I find that, most practitioners in practice, whatever their specialty is, there was some driving factor, whether it was a patient that you were frustrated with a case, or it was your personal health challenges that drove you into that. And so I think it's wonderful that you went into the Epstein-Barr whole process. And we know for the thyroid aspect of it is that it can be cross, symptom wise. So, a lot of the thyroid patients have the same symptoms that the virus would present. So what are some of the common symptoms that somebody would exude if they had EBV currently in the body?
Oh, that's a loaded question. So let's zoom in and zoom out. Zoom in is total exhaustion. That is total exhaustion and brain fog. So brain is on fire. You can't comprehend things. You can't do things. And then the fatigue is basically feeling like a truck ran you over. Basically, some people cannot really lift off the sofa and walk to the kitchen. So they can't take care of their kids. I heard a concept of, I'm just a stranger sitting in my house, watching my kids grow up and watching my husband, watching my family, but I can't participate. I'm just sitting there watching. It's heartbreaking. So that's kind of on the superficial level. Pretty much most of the population is plagued with that. And of course it would be totally like thyroid. Mm-hmm. Thyroid often goes with chronic EBV. But there's different layers, because you can have acute mono, which is like the worst flu in the world that hits you for a few weeks. But what medical community doesn't understand is that for some population, that mono becomes chronic. There's a chronic mono syndrome in medical literature. And so that chronic fatigue becomes a chronic fatigue, exactly. You get that label later. But eventually, depending on your weakest links, your genetics, your presentations, your input, whether it's thyroid or not, for some women it's thyroid, for some women it's not thyroid. But depending on a person, you will possibly develop autoimmune disorders, 1, 2, 3, and eventually possibly even cancers, oncogenic. So, and it's the only virus that creates an environment for autoimmunity this in a number of ways, to the point where last year there was a study that even, it's the second study I've seen on celiac, there is a specific DNA area, specific protein from the virus that can open that avenue. You know, you can manifest with celiac. There's a direct, not correlation, it's causation. So the tentacles are huge. So basically, in medical literature, there are claims if there is a refractory condition, medical condition that is chronic and it doesn't respond to any therapy, suspect chronic active Epstein-Barr or chronic severe active Epstein-Barr.
So I think there's a lot of stuff in there, right? The symptoms can look very similar. There's a huge tie to hypothyroidism and Epstein-Barr. There's a number of triggers that can do it. One of the big things I think is important to kind of discuss and keep on topic there with what you're talking about is, and we talk about this all the time, so our tribe kind of understands this, that there's something that triggers hypothyroidism, right? We talked a little bit offline that it's some type of cellular stress is what causes the cells to deactivate thyroid hormone, because if you increase the metabolism of a cell that's got a bacteria, it's got a virus, you help that virus replicate. So the intelligence of the immune system and the cellular system is pretty smart. And so what happens is we get deactivation of thyroid hormone locally in that cell that's trying to protect itself. That causes all the hypothyroid symptoms. So there's a huge correlation for somebody to have hypothyroid symptoms if they have a acute or chronic infection, because part of the natural defense response is to deactivate thyroid hormone locally.
Right.
The big mistake, Kasia, that we think we see is that doctors don't think people have a thyroid physiology problem until the gland becomes diseased. And that is our argument, that that's the end stage, not the beginning stage. So from our world of looking at it, we look at that viral infection like, hey, that is the trigger, right? The reactivation, and I want to talk to you a little bit about that as well, about acute versus chronic and why that may happen. But we see that viral reactivation, which is what the case is for most people, is the thing that now the body says, whoa, we've got this virus stealing electron flow from, or affecting electron flow inside the cell. And now that's a threat. So deactivate thyroid hormone, kick in autophagy. Let's not bring glucose in here. Let's get this thing under control. Would you agree with that assessment?
150%. I mean, you're talking about electron transport. Mitochondria are a perfect target for EBV. But I would say, well, okay, this is the upstream. We're looking at causes. From this place that you just explained, let's look upstream. What actually is the biggest trigger that reactivates the virus? Because up to 95% of global population has the virus.
Yeah. So what's your thought process on it? Yeah, because I got my theories, but I'd love to hear yours.
Well, I'll tell you the number one of all the triggers that are in the medical literature, proven. All that there's two. The biggest one, I always say, could you compete in any way with astronauts? Could you? Because I couldn't.
Okay.
It's an odd question, right?
Mm-hmm.
Yeah.
I happened to be at a conference when there were scientists that work with NASA, and there were talks about research in space and so on and so forth. And I remember seeing research on Epstein-Barr being reactivated in space. So I had a conversation with one of them saying, do you guys know about this? This is really, you need tools. Do you need help? I know what to do. Well, NASA is very tight, of course. There's no way that any outsider could come, but they told me, well, of course we know it. Every astronaut in space prophylactically gets an antiviral medication because they do reactivate Epstein-Barr. So think about it. This is the cream of the cream, highly specialized and trained individuals. Regardless of that, they may reactivate. The number one reactivator of this virus, no surprise, is stress. Physiological, physical, circadian rhythm is affected, space, confinement. You build it, physiologically, the body's in a very different environment. People don't realize, people think stress is just, I'm stressed. Mm-hmm. But I can see in our population, at least in the States here, the amount of stress people are under, the amount of changes people are under is unprecedented. If it changes, accumulation of changes is very stressful. And the list goes on. You both know what I mean exactly. I think this is a number one. And how does stress affect thyroid? It goes right into the T4, T3 conversion, right there.
Right. So I think what you're talking about is exactly what we talk about all the time. Stress can be physical, it can be chemical, it can be emotional, it can be microbial. And once that cell has that stress trigger, right, we move out of that homeostatic regulating system into an allostatic system once we have enough of a electron flow drop or enough of a stress response within the cell that activates the cell danger response. But I would say, because you brought this up with the astronauts, why do astronauts get more reactivation of their viruses? I would give you a good explanation. I'll give you an explanation. I can't prove it to you, but it's my working theory. And I think it's one of the major reasons we see it happening so often here on planet Earth. And one of the biggest factors that causes disruption of mitochondrial physiology and problems within the cell is hypoxia. And so now you've got a bunch of astronauts going off in space. They're under oxygen, so they have decreased oxygen flow. And so if you have decreased oxygen flow, that's a huge thing that can cause dysregulation of what they call the electron transport chain. And now you have dysregulation of the electron transport chain, you get iron dysregulation. And if you get iron dysregulation, now you have free iron, and free iron will reactivate dormant organisms, right? And so that virus is either alive and active, it's functionally dormant, or it's dead, right? Most of us are walking around with functionally dead or functionally dormant viruses, bacteria, organisms. And when we have this hypoxia that we induce from an astronaut, pretty easy to do, right? Because they're living in a less oxygen loaded environment. But even most of our patients, because of the load of processed food we eat, we've got all these damaged oils that we're consuming. They become part of our cell membranes. That creates cell hypoxia. We have people that are chronically inflamed, that are mouth breathers, and as they're mouth breathing and snoring all night, they're creating hypoxia. That hypoxia then induces more of the stress response. I think and I haven't read the book, and you probably have, or talk about this, but it's this hypoxia that's induced, that's a huge issue for so many people of why they have chronic infections. And it may be dietarily based, it may be respiratory based. That's just one of them. But I would think when you talk about that astronaut, hey, why do they get the reactivation? I would say that, all those stressors play a role. But one of the big ones is what's happening, are they becoming in a more oxygen deficient state, which then again creates that stress response, right?
I agree completely. Yes, because the hypoxia is a huge concern for them, and they were actually talking about the case. They were showing the numbers, and there are constant cases of slight hypoxia in the state while you're in the space. Oh yeah, absolutely. Absolutely, I agree 100%. Mm-hmm.
So let's dive into the next piece, and I think this will be a great segue into it. And that most people, at some point in their youth, have contact with Epstein-Barr virus. Maybe they got mono, maybe they didn't actually get an official heavy case of mono, but most of us have viruses, bacteria that are in the body, right? And I think most of us in functional medicine who are looking at this from a little different window aren't thinking that, we get infection and we get rid of it. I think a lot of us who are kind of looking at functional medicine from a different perspective are saying, we're not really getting rid of this stuff. We're knocking it down. We're putting it back into dormancy. And the reason the person has chronic Lyme or chronic viral infections is because they keep reactivating it, or they're never putting it back into dormancy. So what do you look at as the difference between like acute or chronic EBV? Do you differentiate those two things? And what do you think is the underlying cause of whether somebody has an acute episode or a chronic episode?
Great question. Where do I even start? What I teach my clients is eventually they recognize exactly what symptoms are their flagship symptoms when the EBV is coming back. So it's a very gray area. I mean, people like to have black and white answers, right? So black and white questions. Whether it's the initial mono or not, it's all also debatable, because you can have reactivation anytime. You can have reactivation tomorrow or 15 years from now, depending on the terrain. Like you said, you know, what's internally going on. And so the symptoms, so a classic mono is supposedly the very first infection, may not be. And people have come to me many times telling me that they've had mono a few times in their lives, not just once. And you don't have to have had mono to have chronic EBV. So it's like such a mixed bag, depends on the story. However, the most important thing to know about this virus is that much of its time in the host, it spends in the latent form, which is when you were talking about sleeping dormant, not doing anything. So it's a waiting game, waiting for an opportunity. It's a little bit like cats who can sit for 8 hours and watch the garden before they strike, yep. Right? And striking is a perfect opportunity when you have high stress. That was the number one factor that we just discussed. There are others. And what happens during the latency is there are claims in medical literature that in latency, it's not that the damage is not being done. The way the virus works is when you have a reactivation, when you feel like that mono symptom, so to speak, come flashing and you're getting really acutely sick. So what happens is when the virus is in the system, it leaves the blood and it goes for organ systems somewhere, whether it's the brain, the thyroid, connective tissue, joints, you name it.
It becomes cellular.
Right. That's where it lives, inside the cells. Some of the favorite cells are T cells, but especially B cells. So B cells are part of your immunity. So it's living in your B cell. It completely changes the way that B cell works. So the B cell no longer can communicate with other immune cells, come get me and kill me because I'm infected. It cannot kill itself. There's apoptosis. It cannot do that. It cannot commit suicide saying, I'm infected, I have to terminate myself. That's all disrupted. So the signaling is all messed up. And it's like the B cells become those immortalized cells that are little factories. And when the triggers occur, then the virus inside the B cell starts using the DNA of the cell, creating RNA and creating virins. So baby viruses, young viruses, they mature quickly. And during the triggering event, so during the reactivation or mono or recurrent mono, the B cells lyse. So this is actually, you terminate them because you kill them. They lyse. The viruses now spill out into the bloodstream. And this is during those short few weeks, this is when you can pick up the DNA. This is the only time when you will pick up the DNA of the virus. Otherwise, it's going to be gone. And after a few weeks, the virus dissipates again, leaves the blood, it's gone. So you only have antibodies. You can't detect DNA. This is the cycle. And so these cycles may happen every 6 months. I mean, I have cases when people track their lives. Oh my gosh, I had juvenile rheumatoid arthritis when I was 14 and I didn't know. And now I'm in my late 40s and I've had bouts of depression, anxiety. I was in college, I was so fatigued. And then the pattern on behavior, physical symptoms, like, oh my gosh, I've had chronic viral infection on and on throughout my life. And what happens then is if you put the right protocol, the right education, and the right concept in people, suddenly they not only can stop it in its tracks when it reactivates, but they can stall it in future. They can prevent it in future within literally a day or two. Just stall it. And then they see the patterns, and then they can watch the triggers, the stress, hormonal changes, and they can stall it so they can change behavior. And suddenly you're no longer a victim of the reactivation or the damage that it does.
I think that's really important about breaking kind of the vicious cycle and having to changing the environment that allowed the virus to reactivate. What are some of the things that you utilize in your practice to put that virus back into its dormancy state besides just changing the environment that reactivated it? Like, is there a certain herb or certain things that you like to utilize to help assist the body in helping to put it back into its dormancy state?
It's very interesting because just recently I've had a case when we've done everything. She's doing great. There's something there. The ear is buzzing uncontrollably, especially in the evening. And I just found out she has Alexa. And that's huge electromagnetic field, huge exposure, Wi-Fi, I'm sorry. And that has to be turned off because Wi-Fi has direct effect on reactivation rate. Mm-hmm. And so I think what I've noticed in different practitioners and medical doctors, and what I hear all the time, whether it's NDs, MDs, we have partial results, it's hit and miss, and you have to do so many herbs for immune modulations. Like I really don't agree. Just like I agree with Eric that you don't mess up with the hormones. You don't mess up with the hormones. You don't provide just one measure medication, let's say, and it's going to fix it. Okay, I lost my train of thought. Oh yes. So you have to be really strategic because number one is, okay, what as a clinician, what do I know? I know all that stuff. But number two is, how do I compress it in a way that a person can actually do it? And also financially, how much money can a person spend on the supplements? And then the third thing is, how many pills can a person swallow? What is it that you have to target to get the best outcome? And and Erica, with your background in nutrition, you agree with me that actually anything I can find, that any supplement I can find, let's say, that can target nutrition and it's antiviral is my go-to. I may use herbs as an adjunct, but they don't have the nutritional makeup. So let's say my big hitters are NAC, selenium. I mean, selenium at very high potency, the highest safe that you can apply, they move mountains. You know about selenium, thyroid number 1, liver number 2, glutathione number 3. I mean, how much good can one little safe? Cancer protection, such an antioxidant. It does world of good against Epstein-Barr virus. And now if you pilot, let's say NAC, it's just an amino acid, right? Again, glutathione, liver. I mean, the list goes on. So if you pile these together, then suddenly you start stalling, like really stalling the virus, because these are very well researched for the antiviral, anti-EBV activity. Mm-hmm. So these are, so environment is one, but really having a protocol that is very smart moves the needle the fastest. Literally within 3 weeks on average, if this is what it is, if it's EBV, we see a turnaround. And
so
then yeah, go ahead.
Let me just kind of jump in there. So I think I want to make sure we kind of tie this together a little bit. for our listeners, one of the biggest things that Dr. Kasia is talking about here is that stress, right? Physical, chemical, emotional stress are the triggers that really set the stage for the reactivation of dormant viruses like EBV. It could be almost anything. And those viruses are there. So foundationally, which is stuff we talk about all the time, we got to look at diet, we got to look at lifestyle, we got to look at sleep habits, we got to look at your, every aspect, nutrition, all those things. The second thing I really like that you said, Dr. Kasia, is, hey, we don't want to just try and out supplement you, because one of the things we talk about is it's not about, you can't drug yourself healthy. You're not going to necessarily always supplement yourself healthy, right? There's a max amount of stuff when you were talking about how much stuff can a person take and how much testing. And I think most of the stuff that we can get carried away with functional medicine is that we're always looking for the next supplement that's going to treat the issue. And that's not really the way it works. So you want to do foundation, which is not the sexy stuff to do, becomes the most important thing, but people aren't as engaged to do that. And then the second thing is having a protocol in place to try and bring that virus back into dormancy. And you're talking about a couple things, and you're talking about foods that can do it. I'm a huge proponent of that. And I do want to touch base on some of the protocol that you use a little bit, because I think it's good because you're providing to some degree some of the antioxidants. I do have a little bit of a question though, because some people might take what you're saying and say, okay, I'm going to do NAC on a regular basis. I'm going to do selenium on a regular basis. I'm going to do these other antioxidants. And the problem we see in the literature, and you can agree or disagree with me, is that we have a natural antioxidant system, right? It's called your NRF pathway. And so we have this natural antioxidant pathway process. We have that supports detoxification, which is critical, right? We want to kill things, and then we want to open the channels for all the toxins from those things to go into bile and get excreted out of the body. So there's problems though, and maybe you want to touch on this, is that if somebody's doing NAC for an extended period of time, they actually inhibit NRF2. So they actually inhibit their body's natural detoxification pathway, right? So we've got to be, in my opinion, we got to be cautious with the antioxidants, because we inhibit or actually inhibit the natural pathway, right? We need some reactive oxygen species. That's part of the healing and killing mechanism, but we got to manage the balance of that. So I'll let you tie to that. Then I got a follow-up question to that. It's something that maybe I really like from a food-based perspective that may support that pathway. So what's your thoughts on the acute versus chronic use of the antioxidants in the killing process, or the return to dormancy process, I should say?
Okay, so let's talk about practicality. This is a great question. So in the book, I had to be very, very careful how I word supplements. I have pages and pages of each supplement and, counter indications. It was the hardest part of the book because it was exposure, and I don't want people to hurt themselves, obviously. So that was hard for me to put together. But the bottom line is what I see long term. So if people don't need, so the virus is aggressive, and by the time people are really immobilized and really have chronic conditions, you have to take measures that are pretty drastic. So that's my approach. We do acute. I have this acute version of the protocol that you can do for 2 weeks. And in my clinical practice, we prolong it. We keep going, and then we start decreasing it. And people read my book sometimes, and they come to me and say, I'm on your protocol. If I ease up, I start getting my flagship symptoms. So I keep going deeper with the protocol and on a higher level. That's kind of how you have to dance around it. It's an aggressive virus, and it does so much oxidative damage. It has so many free radicals that it creates that even if you have a good amount of antioxidants, this is not a match. So the problem with this virus, it's not a match no matter how healthy you are. You have to provide antioxidants, the more the better, because you have your own damage, you have the viral damage, and we have so many oxidants. We are so insulted. I mean, people don't realize, like you said, you have bad fats, or you have omega-3 that is rancid. You haven't refrigerated it. You've had it for 2 years. you're ingesting rancid omega-3, that's free radical damage right there. So we are inundated with free radical damage. We don't have nearly enough antioxidants, period. It's just where we are. So I don't have concerns. The concern is when people are on the higher doses, if they don't do well. Sometimes it's very easy. People take a lot of NAC and at certain points it starts hurting them. They don't need it. The body's utilizing it so fast because there's so much damage from the virus. I think the body's actually using it, running with it to just stall it. And then when you're done, you're done. You can spin back. It's just so, the virus is so predictable in so many ways. If it is what it is, it really is. Like, I can back all the supplements to a certain point, but if I go lower, my symptoms come back. I know exactly what it is. This is a story I hear all the time. And some people, I had a case when a woman had psychosomatic symptoms induced by her previous mono. That was over. She wasn't reactivating, but she was such an anxious person. She was projecting it. She was creating it. And she was taking supplements, and she had so many symptoms from them. It was just, basic high doses of the protocol. And they were just causing stomach upset. She didn't need them. We figured it out. This was not EBV. She stopped it. She was fine. That was just one case of all the cases I've had when the protocol turned against you and did not provide support. So I don't have these concerns just because people are so sick, they are so compromised. There's so much that you have to make up for. There's so much oxidative damage that is done by the virus.
So is part of the concern when you have a patient who's saying, hey, I can't get off the protocol because the issue comes back? One of the things we talk about is foundational issues. So if they keep saying, well, as soon as I come off the protocol, my symptoms come back, is it, in my mind, as I kind of listen to something that then the person's not addressing what's something foundationally, right?
Correct. Yes.
Allowing for the foundation, because the virus is really feeding on you. I mean, you're trying.
Yes.
We want to try and get the organism back into dormancy, right?
Yeah, you have to, exactly. You have to change your baseline. And so when you start through the healing process, you start learning the concepts of the virus, concept of yourself, concept of, people live in their head. They don't have the respect for the body. They just take it for granted. And, just the whole concept of changing how you look at your body and what it's trying to do and how it's trying to protect you and all that. When people get that and start taking care of themselves, their baseline increases to a point where it's much harder for the Epstein-Barr to reactivate. You may have very basic supplements at that point, very basic. Bless you. And if people are not improving, I have checklists, like different places, EMF. Do you have a new router? Is it in a box? Do you have a new smart meter? These things really affect the person's ability to have that normal baseline and be healthy and live their lives. So yes, the foundations are huge. I mean, we just talked about stress. There's other triggers, obviously.
So why don't we talk about some of the other triggers then? So we talk about stress, right? And we know that they're physical, they're chemical, they're emotional, microbial, but what are some of the other stressors that you see that may trigger the reactivation of EBV?
Flooding of new hormones, and especially stress hormone, but also I see, and that's relevant to thyroid, postpartum, for example. How many cases of postpartum Hashimoto's do you see, right? Or sometimes it's not diagnosed, but sometimes if a woman is lucky, she's tested and there's Hashimoto's, right? Mm-hmm. And if you were lucky to be tested for EBV, you might see that it's reactivating EBV, actually.
Yeah. They might be going together. Are there food-based triggers? I know we know with the thyroid that there's a lot of inflammatory foods that can cause thyroid issues, but are there certain foods that are known to reactivate the virus?
Well, there's the big concept of NF-kappa B. NF-kappa B is an inflammatory marker, but what people don't know is that it's a protein that EBV really loves to utilize, hijack, and use for its own replication. So the more of it you have, the better it multiplies. And NF-kappa B is junk food. You can increase NF-kappa B by, there was a study by when just one junk, it was 2 hash browns and then egg sausage muffin, something like that. 150% increase for 2 hours in NF-kappa B. So now you have the breeding room for EBV. So that's the junk food. Oh yes, so there's more. And there's millions of foods, herbs, and spices, culinary spices you can use that are anti-inflammatory, anti-NF-kappa B. Very, very simple, right? Lots of them. You guys know about those. There's some research on eggs. I know Medical Medium is really trying to hone in on stopping consumption of eggs. Eggs are tricky. There was one study showing actually IgE allergy and eggs and EBV. And the way the vaccinations for some viruses are harvested are from the eggs from hens. So there's that connection. So that's a gray area. It's complicated, but I've seen cases when a person would tell me I was perfectly fine with eggs before in my life. Now I have this chronic EBV. I can't really eat eggs. I feel worse. And in the Facebook community, there is a lot of agreement that for most people, eggs are actually not a good idea. So that's a big one. There's a confusion about arginine. People restrict arginine foods. And while it is logically a good thing to do, instead, if you provide lysine, and lysine is one of my big hitters too, if you provide enough lysine, that compensates arginine. You need arginine and lysine. The problem is that a virus converts arginine into citrulline, and citrullination causes autoimmunity. And that's one of the ways in which this virus, like no other virus, causes autoimmunity, whether it's lupus or Hashimoto's or other forms. And I think the more into plant roughage you go, the more antioxidants you have. Like this is really the direction. And then you need the fiber from plants to recreate the terrain, to feed your enterocytes in the colon in particular, to create the right pH, to create short-chain fatty acids. Short-chain fatty acids from the fiber fed by the good bacteria. The short-chain fatty acids, like butyrate, and some people may know about that, they actually get into, some of it gets into the bloodstream and feeds your Tregs. And T regulatory cells are paramount in actually controlling inflammatory regulatory cells, and even T17, which is autoimmune triggering regulatory T cells. So it's like we really need to have go back to more plants to recreate a stronger foundation in the terrain, in the gut microbiome, support the immune system this way. Does it make sense? Of course it makes sense to you.
Yeah,
I hope I didn't make it too difficult for the audience, but really there's no go around it. If you have more meat and more dairy, that's inflammatory, and it's really hard on the liver. There's too much fat, and so it's really hard for the body to then fight the virus on top of that.
So let me kind of summarize all the stuff we just talked about, and that is that there's at the root of what's going on is inflammation. We talk about that all the time, and one of the master drivers of inflammatory chemicals, these things we call cytokines, is this thing called NF-kappa B. And NF-kappa B is what you were referring to when you were kind of talking about, hey, the NF-kappa B is the big guy. NF-kappa B is like our big inflammatory oxidative molecule, and we have something that offsets that. It's called NRF2. So those two things kind of balance each other out. So if you're listening to this and saying, what are they talking about all these letters, and I'm getting confused now, you have a natural anti-inflammatory antioxidant system that the body runs, and it utilizes one major enzyme called NRF2, and that turns on about 200 antioxidant detoxification systems. Really, really key and important. And then you have the thing that's when there's some type of stressor or some type of cell damage, that those stressors trigger something called NF-kappa B, which then triggers the inflammatory response. And these things are naturally designed to balance each other out. So we get tissue damage, we get the stress, we increase NF-kappa B. The NF-kappa B produces these inflammatory cytokines to kill the process, to kind of deal with the damage. And then it also helps trigger the antioxidant, the anti-inflammatory NRF2 to come in and shut it all back down again. So we have a natural process to do that. And one of the things Dr. Kasia is talking about is that when we have a chronic infection, like a chronic Epstein-Barr virus going on, we get chronic increase of something of that NF-kappa B. And the real downside to what's going on here when we have chronic stress, chronic infection, which is why we talk about the foundational things being so important, is NF-kappa B, this little bugger will actually block. Initially, it triggers your natural antioxidant, anti-inflammatory system. It kind of activates NRF2, but then if you have it long enough, it actually inhibits its ability to work. So one of the factors, and that's what I was kind of trying to tease a little bit about, is that we need a way to not overwhelm and prevent the natural antioxidant system, but we sometimes have to shut down NF-kappa B just so it allows the NRF2 system to do what it wants to do. And there is another way, and when you're talking about food, which is great, because many of the foods that we eat, when we eat real foods, real vegetables, right, are loaded with flavonoids and other things that actually trigger or can activate the NRF2 system. One of those things, it's one of my favorite things, we've talked about this on the podcast, is sulforaphane. Sulforaphane is like at the heart, is on my heart. I was just up at in Minnesota because we took 2 years, but we finally got a really good quality sulforaphane product out with US enzymes. But if you're looking for natural ways to reduce or try and get that immune inflammatory process back in check, broccoli sprouts or quality sulforaphane supplement can help block NF-kappa B. So this chronic NF-kappa B from chronic inflammation, sulforaphane will actually shut it down. It'll block it. And that's one of the best food ways to kind of try and get your immune inflammatory process under control. Would you agree with that, Dr. Kasia?
Absolutely. Broccoli sprouts are one of the best. Well, the thing is, we have mechanisms, but the mechanisms depend on the building blocks, and the building blocks are in foods. Mm-hmm. And while you mentioned vegetables, what I don't hear mentioned in the medical community, in the function community, and now in the consumer community is fruits. Because when you look at the phytonutrients, antioxidants makeup, fruits really have more to offer than we remember. And so I just want to mention it so that the listeners stop being afraid of fruits because they have so much to offer. We do need those building blocks to come and support the antioxidant processes. But I agree with you. The cabbage family is phenomenal for I have quite a few recipes with cabbage in the book for that reason. And of all of them, sprouts from cabbage and broccoli in particular is probably the queen of the queens.
Yeah, I think that anytime you can be getting something naturally from food and not a supplement, because, with all of our patients, it's hard to get them to, take supplements. So if we can encourage them and teach them that there's foods that they're already going to be buying that can help to support some of these pathways, I think is really important. And I think, along with the fruits, with all the low carbs and the keto diets out there, people are really afraid of fruits, and they, there's great antioxidants in those bright colored fruits, and we often become afraid of them. So in moderation, not in excess where you're only eating fruits, I think that they can play a huge role in this. As we're wrapping up this podcast, can you leave our listeners with 3 tips if it relates to just promoting health or as going along with the Epstein-Barr that you can just leave our listeners with?
I think one surprising tip that's, I assume majority of the listeners are women, would be, number one would be to really step into a new concept of that you are loved, you are enough. Yeah. Because if you can bring it back into your life and really work with that, then you're going to have better boundaries. Then you're going to delegate more. Then you're going to make better decisions, not out of guilt, as women do. You won't overextend yourself. You will have some space. You will have time to recover, to get enough sleep. You won't be trying to prove anything. Type A personality it's pretty much the community of chronic EBV. Overachievers, women that are trying to prove something. You don't have to prove anything. If in that environment you can heal. Number two, I would say the biggest one that I try to teach my community and my clients is that you can heal. But people that are chronically ill, even with thyroid, you have to believe that it's possible. You have to give yourself permission and step away from the victim mode, especially with chronic EBV. There's so much information, and the concept is you have it, you're stuck with it, that's the best you can do, and that's it. It's not true. Mm-hmm. And even medical literature says it can be reversed. It's treatable and reversible. I'm quoting a medical doctor. So these are the two. And the three, find joy. Because you can only heal if you are in joy. If you are in fear, the healing is not physically possible. It's like being pregnant. You can't be half pregnant. You are or you are not. Stress response. You turn the chemicals on, you change the chemicals, switch, right? And joy is one of the experience that opens that healing. And joy is fun. So finding laughter and finding things that you stop doing because you're too busy, going back to them, whether it's drawing, riding horses, maybe you have to change your environment and your job. There are some serious things in people's lives that causes reactivation and the chronic EBV. If you have to walk the life you came to walk on this planet, everybody is of service. And so if you are not in sync with that and you're conditioned by your fears, by projections of your family and expectations, you can't walk that walk. You will be more susceptible to chronic infections like EBV because you'll be susceptible to stress and it's going to be deep. And that's what reactivates people. So these are three, but they're unexpected, I know, but these are really foundational things that I work with all the time. And then healing starts.
I think you're key. I mean, we talk all the time about this is a foundational stuff for us, is that you have to have emotional stress, right? The stress of life is really not the problem. It's how we internalize those things because the same thing that may freak out Erica may be something that makes her husband super happy, right? And so it's not the stress as much as it is how we internalize many of those things when we talk about emotion and psychology and stuff. I think the other point that you made is you got to believe you can heal. You can't get well with this sick mentality, right? And so I think the one thing that's tough in communities many times is that we start to identify with our community and, hey, if I get myself better, now I'm not a part of this community anymore. So we have to have a health mentality because you can't fix something with the same problem, with the same mindset that created it, right? And joy, whether somebody's probably listening to this and going, yeah, well then she's not sick. I mean, she wants me to have joy, I'm sick. But I think the point is that you're making is really important is that you have to find some level of hope and happiness regarding your situation.
The spark.
It really becomes a problem. Because if there's no reason for you to be happy or joyful, then why would you work to becoming healthier and better? And I know, so for people who are chronically ill, they're like, but you don't know my situation. Almost, I would say every person that I know who's in the functional medicine community's got their story to tell, their chronic illness story that led them down this path. And so we all understand that, I think, on this page, in this little group that we're talking right now, is that mindset is huge. Habits are huge. Diet is huge. But those three things you hit were really all about mindset, and how you internalize the external environment changes your internal environment. And that is huge. And anytime somebody doubts that to me, I'm like, do you like to speak? No. Great. I'm going to have you speak in front of 400 people right now. And what happens? They want to throw up. They got to pee their pants. They're going to poop, right? And so I'm like, that is stress, emotional thought, changing your internal chemistry. There's nothing more quick than have somebody tell them you're going to have to, they start sweating. Everything changes about their physiology. And the problem is, if they're thinking negatively all day, every day, or thinking about their sickness, their illness, their EBV on a regular basis, they're almost contributing to the poor state of health, right? So I think it was brilliant, those last three pieces. And most people would come up with probably something else like eat healthy or whatever. Those things are all good. I'm not putting those things aside, but I think how people focus and think, where their mind goes, has a lot to do about where their health goes. I think is
I'd agree on that, and I think that you sharing your side of the virus and kind of connecting the two with the thyroid is really, really important. And we really thank you for coming on here and sharing your side of it and your expertise, because you definitely you know a lot about the virus, and we're just very happy that you came on there and shared your information with us and our listeners.
I am so thrilled I could share what I know with your community, and you guys are amazing. So keep working your magic.
All right. So what was the book again?
The Epstein-Barr Virus solution.
Okay. So we'll make sure all the information is up on the podcast information, and everybody go out and buy the Epstein-Barr solution. And we thank you so much for being on, and we will sign off until our next podcast. All right. Take care, everybody. Thank you for coming on, Dr. Kasia.
Thank you so much for